People of color are less likely to have received a COVID-19 vaccination. There are several reasons they are less likely to receive it. The factors of low trust and difficulty in accessing the vaccine due to systematic issues are prominent causes for the disparity. In fact, vaccine hesitancy is 8 points higher among African Americans than white survey respondents. According to the Kaiser Family Foundation's vaccination monitor, this can be attributed to many things, but one of the major ones is negative medical experiences, both current and historic. To build trust in people of color, it has been proposed that if the individual's physician recommends the COVID-19 vaccine, it is more widely accepted. As well as physicians, faith leaders, and community leaders, engagement and information increases vaccine rates. Physicians, faith leaders, health clinics, and community leaders reaching out to the community which they serve and reserving vaccines for those living in the community helped increase vaccination rates. In addition, pop-up clinics in churches and community centers in communities with undeserved populations of color were successful at increasing the vaccination rate among these people. Partnering with local leaders in the community, such as Dr. Ordell Owens, the former coroner and recently retired leader of the health equity nonprofit Interact for Health, would be one such example of a potential partner. Along with trust, systematic access of the vaccine is pertinent to people of color being vaccinated. This accessibility includes location, language barriers, transportation, cultural competence in healthcare, delivery of services as all points which must be addressed to increase vaccine rates in people of color. These system issues must be addressed to make vaccines more readily available to people of color. Accessibility has been an issue with COVID-19 vaccines. According to NPR, large vaccine clinics were not set up in communities with people of color, and internet access made sign-up difficult for people of color to access sign-ups due to unreliable internet sources. In addition, the University of Pittsburgh School of Pharmacy found African Americans were more likely to have longer driving times to access vaccine sites. In addition, the New York Times describes phone registration, internet access, and speed and unable to take time off work as significant barriers to access African Americans and Latinos. Time off work is found to be significant because a disproportionate number of people of color work in frontline jobs and are unable to leave for a vaccine appointment. Also, the phone lines must be bilingual for Spanish speakers.
So what we aim to do with our presentation is provide a plan that leverages community support with accessibility and convenience. We aim to pair a coordinated effort of recruitment with bringing together partners that can provide services of additional value to the community. Utilizing the Newport Riverfront area, the Purple People Bridge, and Sawyer Point, we could provide a COVID-19 responsible environment to get vaccinated and enjoy multiple resources, including live music, food boxes for families in need, and the ability to sign up for resources, like food stamps or free phone lifeline programs. Issues to access can be solved through a variety of methods, providing the ability to sign up at local churches, recreation centers, and apartment complexes provide access to community members who may not have good internet access. Busing has already been utilized by the City of Cincinnati, and providing busing from certain PIC locations can solve the transportation and parking cost issues that some individuals face. Providing tents with chairs will allow for individuals to have a space to sit and be monitored post-shot. Communities of color are disproportionately bereaved by the COVID pandemic, and local mental health providers could be on site to provide access and offer brief screenings. Utilizing the park on a Saturday from 11 to 6 would allow for people who work during the week to be more able to easily attend. Community partners like Kroger and Procter & Gamble could be solicited for donations. The capacity and understanding to manage this exists in the community, as these are traditional event planning items that would just need to be scaled for the amount of shots being provided. We planned for the Johnson & Johnson shot, but while it is paused, we would either require a second event 2 to 3 weeks in time from the first, or utilize on-site community partners to schedule the second shot. In short, this idea utilizes established local leaders and environments to recruit participants. It provides access, accessibility, and general concerns, as well as vaccination opportunities. It places vaccination as a moment where it belongs, a moment of joy, sunshine after a long winter, and an opportunity to heal and go forward with a safer community.